Hi everyone, thank you for tuning in to our First Aid Friday. I am Bree Maloney and I am here with Dr. Nathan Kiskila. Happy Friday to all of you. This is our first live Friday event of the new year. So happy 2020. Happy 2020.
Thanks, Bree. Thanks for having me here. Sorry I missed last Wednesday, but happy to be here today.
Of course, no worries. Well, we're happy to have you because we are talking about a subject, bronchitis. I'm sure you've heard of it. But the reason why we have decided to talk about bronchitis today is because we have seen more cases of bronchitis in the last week than we have this time last year. So it is going around, it is in our communities, and we wanted to bring it to attention to let you guys know what the signs, the causes, the symptoms, how to prevent and avoid getting bronchitis, and also some treatment options. So, fun fact about bronchitis, I guess it's not really fun because bronchitis is not a fun topic, nor it's fun to have, but there is over 3 million cases of bronchitis that is diagnosed every year.
Yep.
Crazy. So thank you again for joining us. So I guess we will first start off with, what is bronchitis? So Dr. Kiskila, what is bronchitis?
Bronchitis is bronchial inflammation. So I always tell my patients that itis in medical or doctor terms means inflammation, just like sinusitis or tonsillitis, meaning inflammation of your tonsils or your sinuses. So bronchitis is just a fancy doctor way of saying bronchial inflammation, or inflammation of the tubes, your upper airway tubes, your bronchi that let air into your lungs. So it's kind of a fancy doctor way of saying upper respiratory inflammation.
And this is just like a, I don't know, the bronchi, is it the bronchi?
Yep.
Is it like the cauliflower things in the lungs?
It's right before, it's the tubes.
Oh, it's the
leading
tubes.
to the cauliflower.
Okay, leading to the, that's my, like college education right there in health and
Exactly,
science,
it's
so.
the very beginning, it's right here.
Okay, so bronchitis is inflammation of the tubes leading to the bronchi.
Leading to your lungs, yeah.
Leading to your lungs.
Yeah.
Okay, perfect. Great. So what specifically causes for someone to have bronchitis or develop bronchitis?
The majority of bronchitis is a viral infection, so viruses cause bronchitis, but again, it's inflammation, so anything can cause inflammation, like excessive coughing can cause inflammation. Most commonly it's viral infections, but it could be bacterial infections.
So bronchitis can be viral and bacterial.
Either way, yep.
Either way. Wow. Okay. Any other causes of bronchitis?
Well, like I said, I believe it's like 90% of the time it's viral, but it could be bacterial. But those are the two most common types of bronchitis.
Oh, interesting. Okay, and then so speaking of causes, so let's say someone does get bronchitis. What are like the first kind of symptoms that you have bronchitis?
Well, it's cough. Typically it's cough. So anytime your body has an infection or something it doesn't want, it wants it out. So if you've got, a sinus head cold, that's where you got all that, nasal discharge, runny nose, because it's just your body saying, hey, let's get it out. Same with bronchitis.
Okay.
The bronchial inflammation, that virus in your lungs are saying, hey, let's get this out. So typically you cough.
Cough it out.
So cough is the most common symptom, but it's an illness, and so anything that could cause illness or a side effect of an illness or your body being sick, like you could have a fever, you can have body aches, chills, fatigue, just all those general symptoms that you get when you get any kind of illness or sickness.
Now, can you develop bronchitis after, let's say, like a sinusitis or something, if everything drains and then?
Yes, you definitely could. So it could be in fact, it's very common what doctors call secondary infections. And so you have one type of infection or illness, and now that kind of goes, I hate to say it moves into your upper airways or your lungs, but it could cause some irritation to where then you develop a secondary complication of your initial illness, which could be a bronchitis.
So you can go from itis to itis.
Yes, you can.
Okay, great. So I wanted to talk about how bronchitis is spread because I'm obviously not a medical doctor, so Dr. Kiskila is talking about kind of medically what bronchitis is, but this is something that I can talk about. So how it's spread is, respiratory droplets, airborne respiratory droplets. So that is coughing or sneezing. So if you're around someone, that's why a lot of people get sick on airplanes, right? Because if someone coughs, guess what? The air just gets circulated around the plane. So that's one of the ways that bronchitis is spread. So it's coughing or sneezing, getting those airborne respiratory droplets around you. You inhale and then you can get a viral or bacterial infection that way. Another way is skin-to-skin contact. So if you're touching doorknobs, touching surfaces that are contaminated with, say, someone coughing or sneezing on a surface that then you touch, and then let's say you touch your eyes, your nose, or your mouth, it can enter in your body that way. You can get the virus that way. Another way is saliva, sharing water bottles, sharing drinks, kissing, anything saliva related. If that person is infected with bronchitis, you can get it that way as well. And finally, I guess I already said, skin-to-skin contact as well. Let's say handshakes or hugs. That's why I always tell, I don't have any patients, but I always tell everyone when I'm doing like wellness events or health fairs or anything, if you're gonna cough or sneeze, the best way to do it is in your elbow, unless you're going, hey, elbowing people. No, you're mostly doing your hands. So you don't wanna cough or sneeze into your hands unless you immediately wash after, but who really has that unless you have hand sanitizer on you? But if you cough and sneeze in your hands and you give that handshake to someone, and let's say you have bronchitis, that person has a really good chance of developing bronchitis, which is not good.
Definitely. And to that point, even being in the urgent care doctor's office, going into a lot of the rooms, meeting patients, talking to them, I'll kind of joke with them, hey, I'm not going to shake your hand because you're coughing, but here's a fist bump or that sort of thing. I always tell my patients with bronchitis, hey, cover a cough, don't be shaking anyone's hands. I'll joke with them a little bit. Don't be hugging or kissing on anyone, while you have this. And so those are the things that you want to do to avoid bronchitis.
And if you're just tuning in now, I am Bree Maloney. I'm here with Dr. Nathan Kiskila. We are talking about bronchitis. We just went over what bronchitis is. We went over the causes, and I just went over the ways to avoid bronchitis. Or some of the ways that you can get bronchitis. So now we kind of want to dive into treatment of bronchitis. So how can you treat bronchitis?
Well, like I said, most bronchitises are viral bronchitis. Remember, viruses don't respond to antibiotics, they respond to your immune system. So we have to do everything to help boost your immune system so your immune system can cure the bronchitis. And so the things that are immune boosters, and we've talked about this before in past First Aid Fridays and When Not to Wait Wednesdays about our immune system.
Yep.
So anything that we can do to help our immune system, and then we want to treat the symptoms. And so if you're coughing, we may use a cough suppressant. That could be a prescription strength cough syrup that makes you sleepy so you can sleep at night, or a non-sleepy cough medicine that you can take during the day. So that's one thing, because it's an illness. If you have a fever, we can treat the fever with a fever reducer. So for viral bronchitis, we really just treat the symptoms. So cough, treat the cough, fever, treat the fever. Resting.
Is that why they're called antiviral medications?
Yeah,
right?
Resting, drinking lots of fluids, those sort of things. However, it could be bacterial bronchitis. If it's bacterial bronchitis, then we would want to treat it with an antibiotic medicine. Bronchitises can lead us into pneumonia. So depending on risk factors, sometimes we want to treat or be a little bit more aggressive with an antibiotic. If you're at a higher risk because of history of lung-related illnesses, if you've got asthma, or a history of pneumonia or COPD, or some other high-risk factors to where this could progress and turn into something worse, then we may want to treat it with an antibiotic for that reason. So kind of putting the whole picture together, letting a doctor listen to your lungs with these. A lot of times just listening to your lungs, we could tell if they're clear, or if they're not clear, crackling, or what patients call crackling, doctors we call it rhonchi or rales, and or wheezing. We can do breathing tests as well. We can even do chest x-rays to make sure it's not pneumonia. And that is
rule
just
that out.
Bronchial inflammation. Sometimes you can see inflammation on a chest x-ray.
Oh, interesting.
So lots of ways to put the whole picture together, just to figure out what kind of bronchitis is and how best to treat it. Everything from, like I said, tools like this, to your history, to things like x-rays that we can look at.
Now, you did mention that it could be both bacterial and viral. So let's say I go into our urgent care and I think that I have bronchitis. How do you determine if it's viral or bacterial?
Typically, by listening to your lungs with this, we can tell if your lungs are really clear, likely viral. But if we do hear something in there, then it's maybe more likely bacterial. Obviously, again, a chest x-ray to see if we can see infection which would typically be bacterial infection that would show up on an x-ray. Sometimes that's
Interesting.
helpful,
Okay.
as well. I guess the 100%, only 100% to know, which we don't really do in the urgent care, most people don't want, would be a lung specialist to stick a tube down into your lungs and get some samples to send to the lab to grow it out on a culture to see if it's viral or bacterial.
Yeah.
But
do it the old-fashioned way there. Okay. Awesome. Thank you. So typically, if you develop bronchitis, and let's say it's either, I guess we can say if it's viral or bacterial, how long does it take for you to start feeling a little bit better?
Yeah, that's a great question. And so it could be up to 6 weeks, and I know my patients don't like to hear that, even sometimes longer, depending on your lungs and the healthiness of your lungs and your body's immune system take care of it, especially if it's viral and really you're just treating the symptoms and you kind of just have to write it out.
Yeah.
How well do you rest? How well do you drink the fluids? What are you doing on a daily basis? Are you kind of, somewhere where maybe you can kind of rest, or are you in one of those professions where, you're out and about and using your lungs a lot? So could take a while, especially if it's viral. If it's bacterial and it responds to antibiotics, antibiotics can get in your system within a day or two and start feeling better. And so really a wide range of how soon you're going to get better depending on what kind of bronchitis it is and how well your body, is used to healing itself.
Okay, interesting. Thank you. And if you're just tuning in now, I am Bree Maloney. I'm here with Dr. Nathan Kiskila. We are talking about bronchitis on this First Aid Friday. I just have a few more questions for you. You kind of maybe answered it, but one of the questions that I actually had someone message us about is, how do you know what the difference is between bronchitis and pneumonia?
Pneumonia,
yes.
Pneumonia is actually a clinical diagnosis. So in our modern technology, we can see pneumonia on a chest x-ray, and we usually use that chest x-ray to diagnose pneumonia, but we don't have to. We don't need to have a chest x-ray. Just by listening to the lungs, depending on how they sound. Remember, the bronchi are up here, your lungs are deep down in here. And so if a doctor's listening to a lot of congestion, a lot of what patients call crackling or wheezing, but doctors may call, rills or rhonchi or rubs, down deep in the lungs, that's more likely pneumonia. Well, pneumonia means lung infection, whereas bronchi means bronchial infection. So it's really that separation just where it is. And so if it's up in the bronchial area, bronchitis. If it's down deep in the lungs, it's pneumonia. Okay,
interesting. Thank you. And last but not least, how can we avoid getting bronchitis? And I think I might have answered it, but anything to add to that?
Well, just what you said. And so probably the biggest thing that we can do is have a healthy immune system. And so taking care of yourself, getting plenty of rest, drinking lots of fluids, and then doing those things that Bree mentioned as far as avoiding getting it, as far as, shaking hands, covering a cough, all that good stuff.
Okay, great. Awesome. Do you have anything to add today about bronchitis and causes and symptoms and signs?
Well, if you have any of those symptoms or signs, coughing, especially if you're coughing stuff up, that green, yellow stuff, that doesn't necessarily mean that you have any particular type of bronchitis or even bronchitis in the first place. But just let someone listen to your lungs. So one of these is very powerful for a doctor who has a trained ear, who sees this every day, or any medical provider for that matter, should be able to listen to your lungs and diagnose you with bronchitis if that's appropriate, and then make any recommendations if indicated.
Okay, great. I wanted to read just our medical disclaimer. So this information is for general interest only and should not be misconstrued as a diagnosis, prognosis, or treatment recommendation. This information does not in any way constitute the practice of medicine or any other healthcare profession. So listeners are directed to consult their healthcare primary provider regarding their specific health situation. Mark Medical is not liable for any action taken by a listener upon this information. But with that said, I want to thank everyone for joining us on this First Aid Friday with bronchitis, and thank you, Dr. Kiskila, for coming on and just really giving us your knowledge about this subject.
Yeah, if you like it, make sure you share it with all your friends.
Awesome. Well, have a wonderful weekend, and we will see you on Wednesday. Take care.